y'all, it's Devin with Rehab Dynamics. Today I wanted to make a video for anyone who is getting a knee replacement or a partial knee replacement or is maybe considering one, or that has a family member that is getting one or has had one, just with some information on what happens during that. A lot of patients ask, like, what does it look like in there now? What did they put in? What did they take out? Do I still have ligaments? There's a lot of questions as far as what actually happens during a knee replacement. I did not put any gory surgical pictures in here, so if you have a weak stomach, don't worry. This is just going to be some simple slides of what the knee components look like and kind of how your knee is changed after surgery. So knee replacements are procedures that basically just resurface the knee, and they use metal and plastic components to cap the ends of the bones that form your knee joint. So it'd be the top of your tibia, the end of your femur, and then usually the back of your patella, your kneecap. Most reasons why people have replacements is most commonly with osteoarthritis, but also with rheumatoid arthritis, severely torn cartilage, or ligaments. People can eventually find themselves needing a knee replacement. And the goal for the replacements is to reduce pain. It doesn't necessarily increase your range of motion, but your pain is considerably less. So total knee replacements, those surgical procedures change all three components of the knee. So that's the medial component, the lateral component, and then the patellofemoral component, which is the kneecap area. So here you can see like a healthy knee. This is your cartilage. It's supposed to be nice and smooth. But then with damaged cartilage, like in arthritis, you can see how it's kind of bumpy, torn up. So what the prosthesis ends up covering is where that cartilage was. That's the end of the femur bone, the top of the thigh bone. This is the top of your tibia, your shin bone. And then they'll usually put on the back of your kneecap another little plastic component. So the back of the kneecap is improved as well. So here, again, you can see that torn cartilage. This is the end of your thigh bone, your femur. This is with the knee bent. The cartilage there is all torn up. You can see the white ligament that runs in between the inside of your knee from your femur to your tibia. There's two of them, your ACL and your PCL. And then this outside ligament here and inside ligament. So those, the outside and inside ligaments, the MCL and LCL stay, but the ones inside the joint, where they end up putting the metal and plastic components, are gone. And the components have kind of essentially built-in ligaments that are used. So you can see where the cartilage was, they've now capped it off with a metal component and then another plastic component just on the joint surface there. Here's an x-ray of an actual replacement. So you can see where it's bright white, that's the new components. There's a little bit of a stem that goes into your tibia bone there, that's your shin bone. And it goes a little bit up into the femur. That's your thigh bone. That's a front view. And then here's a side view. So it's just the surfaces where the cartilage was. And then here's your kneecap, this little circle here. Usually on the back of that, they'll put a component. And then there's just a general picture of what it looks like on a whole body. Just the inside parts of the knee. And again, they save the ligaments on the inside and outside of the knee, but they get rid of the ones that are actually within the knee joint right there in the middle, the ACL and the PCL. Those are removed. And the scars. I'm sure most of you have seen people with knee replacement scars. This is pretty soon after, but after a few weeks or months, it gets really thin and white and you can barely see it. And in therapy, we do work on the scar so that it gets smooth and doesn't get stuck to your shin bone or your kneecap, because you can get those scar adhesions. And then also it makes it smooth and small. Now, a partial knee replacement is less invasive, of course, than a total knee replacement. The partial knee replacements only replace one compartment instead of all three. And usually the most commonly replaced one is the medial compartment. That's the inside part of your knee, but some people do get the lateral one done. And in this one, your ACL and your PCL, the inside ligaments that are within the knee joint, those are left there. So you have more of your body's own structures spared with the partial knee replacement. So you can see here where the cartilage was worn down on the inside part, and then it's just been capped with a metal component. and sits on top of a little plastic cap. Much less work done, much less invasive, easier recovery. So if people only have issues with arthritis on one part of the knee, they don't have to go replace the entire thing. They just replace the part that's worn down. And here's an x-ray again. You can see this is the inside medial part of someone's knee, how the joint is just closed down. There's no joint space. It's just bone on bone. So then it's replaced and you can see that space is back. So that's an actual x-ray. And then of course you have less of a scar with with the partial replacement. You can see a tiny bit on this patient's medial part and then a tiny scar on this person's lateral component. So much less invasive. So if you can get away with getting a partial knee, of course, that's preferred, but total knees are very common. And there's another view. This guy got 2 knees done at once, it looks like. But anyway, I hope that kind of clears up the process of what a total knee replacement or a partial knee replacement does and what it looks like. And whenever you come into physical therapy, we of course work on swelling, range of motion, pain control to get you back to what you love doing. Thanks for joining me.